We welcome you back to our WTVA 9 News Coronavirus Town Hall. I'm Craig Ford, joined by Dr. Mason with Baptist Union County. Let's get to one of our viewer questions. The first one we've got for you: what is the process once someone has been diagnosed with a virus?
Most of the time, it depends on your symptoms. As I said earlier, for the vast majority of people, the symptoms are going to be mild. So what we recommend that you do is that you stay home and you self-isolate. There's a difference between quarantine and isolate. Isolation is when somebody is sick, removing them from other people. Quarantine is when you stay away to see if you develop. I think it's important for the people to know that. So the first thing that you do is you isolate yourself and you give yourself supportive care. Drink plenty of fluids. Take Tylenol or ibuprofen for the fever. Monitor your symptoms. Should you get worse, should you develop shortness of breath, call your physician. They may want you to come in and be seen, or they may recommend that you go to the emergency room.
And that leads me to our next question, which is, who decides who goes home to be in self-isolation or to quarantine, and who goes to the hospital?
Sure. That's a great question. As I said, if you think you have the coronavirus, I would recommend that you call your physician, or once you're diagnosed with the coronavirus, your physician, or if you happen to have gone to the ER, they will make that judgment, that clinical judgment, and say that you might be able to go home, which you should. Most people will be able to go home and remain at home. Should you have serious symptoms of shortness of breath, should they measure your oxygen saturation and it be low, they may recommend that you be admitted to the hospital for closer observation.
Briefly, let's talk about testing.
Sure.
We've heard a lot of discussion about that as of late. Can you go to the hospital? Can anybody go to the hospital and get tested? Are there limitations? What?
I think there are limitations. At our hospital at Baptist, we recommend that if you think you might have coronavirus, call your physician. If you don't have a physician, you can go to baptistonline.org/coronavirus, and we have an 844 number that you can call, and we can put you in contact with a physician. Call your physician, and they will ask you a series of questions, and based on those questions, according to the CDC guidelines, they will recommend that you be tested, your primary care physician. Most commercial labs now that the clinics around the area are using are up and running, and they are doing COVID-19 testing. And each lab has a different process for collecting the specimen, and your healthcare provider should be able to direct you.
So how does that test work? Let's say I need to be tested. What is actually done in the office or at the hospital?
It's a nasopharyngeal swab, and most people have been swabbed at some time in your life for the flu or for strep throat. It's where they have a swab, and you open your mouth and they swab the back of your throat. They take a nasal swab as well.
And they basically have to go a long way in order to get what they do.
They do. It's important to get a good test. It sure is.
Gotcha.
It sure is.
Since you mentioned flu, I do have a question for you about the flu, actually specifically about the flu vaccine. Will the flu vaccine help offset the coronavirus? Will it lessen the case if the person gets the virus?
No. The flu virus, influenza A and B virus, and the coronavirus, novel coronavirus, are two different types of virus. So having the flu vaccine is not going to help you with the coronavirus. However, there still is a lot of flu going around. We're still seeing a lot of flu. We still recommend that you get the flu vaccine.
All right.
Yeah.
We're going to take another quick break, and we will be back with more of our WTVA 9 News Coronavirus Town Hall.